Hi, my name is Marissa Harris. I'm a physical therapist here at KSB. I'm going to be talking about improving women's pelvic health fitness. What is your pelvic floor? Your pelvic floor is a group of muscles that attach to the base of your pelvis. We're going to review pelvic floor muscles. You have 3 layers of your pelvic floor muscles. We're going to start superficial and then work deeper. Layer 1 is your bulbocavernosus, superficial transverse perineal, and ischiocavernosus. Layer 2 is sphincter urethrovaginalis, sphincter urethra, compressor urethra. In layer 3, you have your levator anine group of muscles, which is your pubococcygeus, puborectalis, iliococcygeus, and then not a part of the levator anine group is your coccygeus. Here is just a visual of layer 1 showing the muscles. Layer 2 does not have a good picture to show really, so then we're going to go to layer 3. And here you can see how each one of those muscles is very close, and it's not pictured coccygeus. And you have 5 functions of your pelvic floor: organ support, stability, sphincteric function, sexual function, and circulation. Organ support supports the bladder, uterus, and rectum against gravity or any added pressure. Stability stabilizes your pelvis and lower back. Sphincteric function controls the opening of your urethra and rectum, which helps prevent leakage. Sexual function plays a role in orgasm and pain with intercourse. Circulation, the muscles are able to pump blood back up towards the heart. Now that you understand the muscles of the pelvic floor and the functions of the pelvic floor, we're going to review pelvic floor disorders. The first group of pelvic floor disorders is urinary incontinence. You have stress, overflow, urge, and functional. The most common urinary incontinence is stress incontinence. That's loss of urine involuntarily with physical exertion. You could have leakage with coughing, sneezing, laughing, or exercise. Another common one is also urge incontinence. You have a strong desire to void with an involuntary loss of urine. Triggers could possibly be running water or cold weather. This is a great image showing the normal function of the bladder. First one is the bladder stays relaxed and the urethra stays contracted and closed until the patient is ready to void. And then you can see in the second one with urge incontinence that the bladder muscle contracts before the patient is ready to void. And then stress incontinence, the urethra is too weak to stay closed during increased intra-abdominal pressure. Another group of pelvic floor disorders is pelvic organ prolapse. You have cystocele, where that's your bladder dropping, rectocele, which is the rectum moving into the vagina, or uterine prolapse, which is the uterus dropping into the vagina. With pelvic organ prolapse, it can be caused when muscles or ligaments supporting these organs weaken. And this can occur after childbirth, a hysterectomy, or menopause, chronic constipation, or improper breathing with lifting. Symptoms to be aware of are heaviness sensation in the vagina, feeling like you're sitting on something, discomfort with intercourse, problems when urinating, problems when having a bowel movement, or feeling or seeing a bulge coming out of the vagina. There are different types of prolapses, like I mentioned, and here are pictures showing normal anatomy versus the cystocele, uterine prolapse, and rectocele. And here's close-ups so you can see each picture better. This is normal anatomy with no prolapse. This is a cystocele, so you can see the bladder is pushing more into the vagina area. Rectocele, you can see that little bulge in the rectum. And then the uterus, you can see how it's dropped into the vagina. There are different stages of prolapse, and this is a great example of the different stages and how to see where it's dropping. And that's more for the pelvic floor therapist to have an idea of what stage you're in. And another common pelvic floor disorder is dyspareunia. This could be pain before, during, or after intercourse. It could be at the vaginal opening, deeper or thrusting, where you might be having the pain. And causes of this could be muscle tension, vaginal dryness, scar tissue after vaginal birth. So 13 million Americans are incontinent, and of that number, 85% of those are women. And then 3% of US women are affected by pelvic organ prolapse. 1 in 5 women experience pain with intercourse. So now that we've went over the pelvic floor disorders, how do we manage these symptoms? So for incontinence, what you can do to try to help yourself at home is decrease bladder irritants such as alcohol, coffee, carbonated beverages, spicy foods, or acidic foods. Make sure you don't do a just in case pee, skip those. When you're urinating, make sure you sit, relax, and breathe. Do not strain or push the urine out, and do not perform Kegels while you are urinating. Breathe slowly and deeply. This calms the signal from the brain to the bladder to reduce that urge sensation, and avoid drinking fluids about 2 hours before bed. How do we manage prolapse? Make sure you go to the bathroom when you feel the urge to have a bowel movement. Use a squatty potty to help with better positioning. Hydrate to decrease constipation. Exercise to keep things moving properly. Eat fruits and veggies as a good source of fiber and magnesium. And make sure to have proper breathing mechanics. So exhale when lifting, inhale with lowering. This could be when you're working out, picking up kids, or completing job duties. How do you manage dyspareunia? Make sure you do slow, deep breathing. If you suck in your stomach, stop doing that. That can tense your pelvic floor muscles. You could try using vaginal dilators. There are different sizes, and this can train the muscles to relax. Try using a vaginal Therawand. This can release tender points within the pelvic floor muscles. Or you can try using a lubrication. The best would be a water-based lubricant. Other helpful tips, you could sip water throughout the day. Drink half of your body weight in ounces, with 3/4 of that being water. Clean your vulva daily with water only, no soaps. Make sure to wipe front to back. Wear cotton underwear, which is more breathable. Are you still experiencing urinary incontinence, prolapse, or dyspareunia with no improvement? You can speak with your doctor to get a pelvic floor physical therapy referral. How can pelvic floor physical therapy help? The pelvic floor therapist will complete an evaluation and assessment. This will help determine how to address the dysfunction or disorder of the pelvic floor, and then we can manage to figure out the best individualized treatment plan to help restore pelvic floor muscles to their normal function and prevent or manage your symptoms. For pelvic floor physical therapy, you'll be seen no more than once a week, and we can help coach you and give you more specific treatments to complete at home. And at the end of the road, there will be a successful outcome. This is just a picture of different women. So women's health is important, and a lot of women do not understand that these things are very common to have, but they're not normal. My references. And then thank you for listening in tonight. If you have any questions, right here's our number. You can give us a call at 815-285-5591. Thank you.